Annie. How are you today?
I'm good.
What have you been up to? I haven't seen you in a while.
I actually just went Black Friday shopping. I actually saw a lady from church that I don't remember her name, but we went Black Friday day shopping. Yeah, we had a great time. I really love Black Friday day shopping.
Wow. Well, it really sounds like you had a fantastic holiday, and I'm really happy to hear that. I know some other good news is that you and your daughter Layla, along with your 2 grandchildren, are going on vacation, right? Is that right?
Yes.
And I hear you guys are going to the Bahamas.
Yes, we're going to the Bahamas.
Oh man, the Bahamas is beautiful at this time of year. It's going to be so much fun. Well, tell me this. Bahamas is beautiful at this time of year. It's going to be so much fun. Well, tell me this. Have you started packing yet?
I haven't really thought about it.
Okay. Well, no need to worry. I actually have this handy checklist here where we can go over some items that you might really want to bring with you. So let's go ahead and start. We can actually check them off. So the first thing I see here is it mentions that you might need to bring a coat with you. Do you think you'll need a coat in the warmer weather?
No, it's going to be warm.
It is going to be warm. So why don't we go ahead and just cross that one off, and we'll save some room in our luggage, right?
Yes.
Okay. Something else I see here. Do you have a swimsuit? Yeah.
I don't know. Yeah.
Okay, you do have a swimsuit because I remember I spoke about it with Layla.
Okay.
So it gives us the option to write how many we want to bring. So I suggest that we go ahead and pack 2 in case one is going to be drying or in case something happens.
Yes.
What do you think about that?
I like that.
Great, so I'm going to go ahead and mark that off here. I'm going to write 2. Excellent. And something else I see mentioned here is that you might need boots for the colder weather. I don't think that's going to be necessary, huh?
No.
So let's cross that one off. Okay. Now, from the things you see here, is there anything else you think you might want to pack with you?
I'll need a beach bag.
Okay, excellent. You will need a beach bag. Okay. And it mentions here about sunscreen. That might be a great idea if you're spending a lot of time outdoors and on the beach.
Yes.
All right, so let's go ahead and mark that off our list. So that looks like a pretty excellent starting point. And I'll be sure to share this with Layla and go over this with her on how she can fill it out so we'll have everything nice and ready. I'm very excited for you. I think you guys are going to have an excellent time. So the good news is I know that you are a people person and you're going to be meeting a lot of people on this trip.
Yes.
So I do have something that will be quite useful. It's just a small card that we can slip in your wallet that goes over what your name is, who you can get in contact with just in case. And also on the back of the card, it has a space for 4 items that we can write that you would like people to know about you. So I'm gonna ask, I left it blank here. I want you to write what your name is in the blank. So go ahead and write that.
Okay.
Excellent. And this says, my name is Annie. I have dementia. If I may need help, please be patient. If I appear lost or distressed, please call Layla Bose, and I put her contact number on there, okay? In case we might need anything. And I'm gonna flip this over. What is the first thing you think somebody might want to know about you that's important to you?
I have a daughter.
You do have a daughter. That's a great thing. I would go ahead and write that. That would be a great conversation starter. Excellent. And I do remember you telling me that you were an art teacher, weren't you?
Yes.
Well, I think that would be an excellent thing to share with others. Why don't we write about that? right, we have 2 out of the 4 done. Now, do you know where you grew up?
Well, I lived on a farm.
You did? Okay.
Yeah, there was a lot of chickens. We even had cows. I grew up on a
Yes,
farm,
fabulous. So
I grew up on a farm.
Layla and I were speaking about this, and you actually grew up in Alabama on a farm. So that would be a
yeah.
really great conversation starter. You never know who you'll meet while you're there, right?
Yeah.
Okay, so let's go ahead and write that. Excellent, great work. And the last thing, I know that one of your hobbies is that you like to knit because you've knitted me a scarf in the past.
Yes, I love to knit.
You love to knit? Well, excellent. Why don't we go ahead and write that down too? Great work. So now we have 4 items that we want people to know about you. So the first one is that you have a lovely daughter named Layla. So we'll check that off. You used to be an art teacher. We know your favorite artist was Van Gogh. And we know that you also grew up on a farm in Alabama and that you like to knit. So we've kind of covered all of the bases here so somebody can get to know you. So whenever you feel uncertain or you want to remember some of these things, you can just turn that card over and you're more than able to just see what it is you would like to bring up.
That's great.
Well, Annie, I'm glad we got some of these done for the day, and I will definitely be getting in touch with Miss Layla and going over this with her. And I'm really excited for your vacation. I hope you enjoy it.
I'm excited too.
Oh, you're gonna have so much fun. Well, it's always good to see you.
Yes.
Why is this an example of a direct treatment? Number 1, we see that memory is impaired, and your job as a speech-language pathologist is to implement a strategy. Number 2, we can classify creating a checklist and also using a memory wallet card as errorless. It doesn't evoke any negative self-doubt or self-thoughts, and it doesn't produce a lot of errors. Number 3, the individual in this example had early stage Alzheimer's. These strategies can work with individuals in the early stages. Number 4, we had a specific target where our goal was to improve a specific function.
Also have this to go over mostly with Miss Layla. It's going to be an emergency travel medical form. And it basically just asks about any allergies, any health insurance policies, and it's just a good item to have with you just in case that we might need. But whenever Miss Layla comes back, I'll definitely go over this with her. Okay, so the good news is
We also want to discuss the concept of indirect treatment. In indirect treatment, you may focus working on more with the caregiver rather than the individual living with dementia. For example, we use the medical forms to work with the caregiver in case of an emergency. Furthermore, in indirect treatment, we may modify the environment, which means we can also modify or alter interactions. That might include training the caregiver on appropriate communication strategies.